Okay, thank you very much. Welcome to the Clear Now channel. This is Dr. Rolf Thomas, the inventor of Clear Now. I have with me today somebody called Sara Leal, who is a very experienced Clear user, and she gets fantastic results. I'm often asked whether foot health practitioners can use Clear and Sara is a foot health practitioner. As I would repeat, she gets excellent results. She was saying herself, it's been fantastic for her business. And so we're just going to discuss a bit about what she does and why she's getting such good results with it, why it's so good for her business. And so I'll hand you over to Sara now to introduce herself and elaborate. Thank you.
Thank you, Rolf. I'm Sara Leal. I'm a foot health practitioner and have been since 2004. I previously worked for about 10 years with the NHS. Then 2015, I started working privately, completely privately, and then joined the Dunstable Foot Clinic in 2018. And as soon as I joined that clinic, I really started using Clear there, and the business just went a little bit crazy. So I do an awful lot of Clear nails now, probably something in the region of 15 a month. And most of my business is actually Clear nail and review appointments, follow-ups. And pretty much every client that I have now that comes back through the door after 8 weeks of having had Clear nail, the treatment, are doing better. So it's very positive and a great machine. So thank you, Rolf, if you'd like to go ahead.
Thank you. So, as I was saying, keep it light-hearted, particularly with limited IT skills at this end.
Absolutely.
So, yeah, machine was a word I picked up on there. Clear Now is a machine at the centre of the treatment. It's a Class 1 medical device for safely making holes in the nail plate that reach the nail bed but don't injure the patient. And that's its real party trick, if you like. So, but around it is a protocol for treating nail infection. And perhaps you would give us a bit of an overview of what protocol you use, Sarah.
Absolutely. What I would say, when you're actually micro drilling and you are doing the treatment with the patient, obviously making them feel as comfortable as possible before the treatment, putting their mind at ease, telling them that it's not going to hurt whatsoever. If they feel anything at all, you will stop, or anything that they're not comfortable, you will stop. And it's really engaging with the patient while they're having the treatment and looking up and making sure that they're all right while you're doing it. And to be honest with you, the treatment and the way I do it now, after all the experience that I've had with it, is I would actually initially do the clear parts of the nail first on each digit. And then I would actually go to the fungal part last, so that you're not actually transferring any of the infected particles back to the clear nail, if that explains it well enough. But yeah, it usually takes about an hour. I give myself an hour per treatment, and that actually gives me plenty of time, just in case you come across bits and bobs, you know, with machines that maybe the code didn't work, so you re-put it in. Take your time. You know, anything that you do is obviously going to be clear for the patient to see, so just make them feel as calm as possible while they're having the treatment.
Okay,
Yes.
thank you. So, one of the things I would say is can be a sort of a mismatch between the patient's expectation and reality. Sometimes patients want to walk in and have a walk out with a perfect nail, and you know, I always say the only thing on God's green earth that we can provide is a mycological kill. We can kill that infection, but the nail's got to grow out. And
Yes.
that's going to take time. Even once we do have a kill, can you say anything around
I,
what you would
I'm
expect?
really thinking, to be honest with you, when I first started, it took me probably a couple of years really to get a really good result with with the patients. But now, for some reason, I've brought that length of time down to about a year, and that is on pretty severe nails, severely infected nails. Um, and obviously, I think I've got better at the treatment, so that's helped. Um, but I've learned a lot of things to enhance the treatment as well in regards to keeping the patient committed to the treatment, making sure that they come back every 8 weeks, just to keep the nails a little bit thin, so that the Lamisil really keeps working, because obviously that is the product that I recommend for the treatment. And I think it's the best one on the market for this particular infection.
Okay, super, thank you. And so you're talking about a significant amount of time there. And is this something that you will managing expectations of a patient when a patient comes to you? Do you generally give them an
I,
idea
I
that
would
it's going to be
I
a
would tell
flat?
them approximately a year to a year and a half for severe ones. I
Mhm,
would definitely give them that information on the first appointment when they're with me,
mhm.
definitely, because I think it's really important to say that, although the topical products that they've used before didn't work, this will work, but it will still take time. And I always tell them that, there isn't a guarantee, but the guarantee I can give them is I will give them a free treatment if it doesn't do anything. And I have done that in the past, and it has pushed people's treatment on and made it more visibly attractive to them, as in they can see now it's moving. So they're happy.
Yeah, and it's interesting to me that you're saying the word happy, and yet you're managing the expectation at the beginning, and saying, you'll give it your best shot and you would expect results, but it
Yeah.
will take time. And that's my experience, is that I often say the best people to treat actually are the ones who tried everything, and then they understand just what a tenacious and difficult infection this is.
Yes.
Um, so that's that's a really interesting sort of timeline. It's quite a significant amount of time. Do you tend to make an assessment when you see somebody and say you're going to be require a few treatments, or you're going to be a relatively low number of treatments, and do you sort of try and again manage their expectation on cost? Do you sort of sell them a package, or do you say, I think you'd be
No, I haven't really. I mean, I will explain the actual cost to them of the first initial treatment, but I will tell them that should they need another one, if their nails are severe, we can talk about that and discuss it in more detail nearer the time. And they may be looking to do that in after 6 months, but I would probably give them a little discount compared to the first treatment. But I never say it's going to cost you approximately £1,000 to £1,500 when I see them on the first appointment. Overall, I would never tell them that.
Mhm,
I'll tell them the first treatment price of making the actual holes. And then I will tell them that the follow-ups are £38 every 8 weeks. And I will see them for about a year. They can work that out, Rolf.
mhm. Sure, okay. And it's a process. I like the word process, because
Definitely.
you get patients that are, people say to me, what's the efficacy rate? And I'm like, it's such a kind of an inappropriate question in a way. It's a bit like when people talk about uh, the death rate of COVID, to just be a bit morbid. But you know what I mean? There are people at one end of the spectrum, young children with really powerful immune systems, who are totally at the opposite end of the spectrum to people who are not. And to pick a number and just pick a number in the middle is everybody wants to know that number, but it's not really an appropriate one. And you get somebody who's got a mild infection and excellent health of fungal infection, which I would just chuck in, often comes from pedicures, in my experience.
Oh, absolutely. Gel nails are just the worst. They
Yeah,
don't allow your nails to breathe.
yeah, yeah, and as
And
you
people
were
leave
saying,
them on for too long. Patients leave them
mm,
on for too long.
mm,
I've had an awful lot of gel nail patients come to me
mm.
saying, please help me with these.
And then you're in a vicious cycle once you've got it. Um, but they may be relatively healthy person otherwise. So in a way, you've got an isolated thing you're focusing on. At the other end of
Yes,
the spectrum, you get people who are just really not in great health as a patient, poor immune system, etc., and just everything stacked against them. They've been wearing these shoes for goodness knows how many years, and their feet are furry with infection. You've got a lot of work to do there, and you can't really put those realistically into the same pot
no,
of
not
efficacy,
at all.
in my view. But on that latter end of the scale, you are going to get some people who really, I think you're never going to get rid of it entirely. You can transform
Yes.
their feet, but
Oh,
you're
absolutely.
there's so much of it in their environment, and their
Yes,
system's not great. And apparently, there is evidence that genetically predisposed. It certainly seems once someone's had a damaged nail and the infections can amplify that damage, that it really opens the door to infection or reinfection. Uh,
yes,
do you are you quite open with some people that you find you'll say that I can improve the aesthetic
yes,
to your nails enormously and your foot health, but I can't guarantee that I'm going to be able to get it. And this is going to be a managing process. We're going to.
yes,
Mm.
absolutely.
Are you able to sort of um, give us some examples of how you might discuss that with them, and would that something will come
Um,
later on, or?
I would sort of say to the point of, I had a 93-year-old lady who came to me and said to me, I need you to sort these toenails out, Sarah. And I said, who am I to say you're too old to have it? I can't say that to anybody. I can't say to anybody. The only thing I will say to them is that whatever you end up with will be better than what you've got now. And off they go to reception and book their clear. Happy days. So I don't, I
That's,
don't say to anybody, no, you're too old to have it. I say,
mm,
your health might determine the results. Um, but there are very old people that are very, very well,
mm,
you know. So it's difficult because I always remember thinking, oh, if they're going to be over 70, they're going to slow down their immune system, everything's slowing down. But they'll still, if you do clear an L on them, you'll still get a better result than what you've got now.
mm.
So that's fine. And as long as you can explain that to them,
And you,
I
you
think they're happy.
you can't better it. My message is always to them that you can't better what we're doing here. There are treatments which are hugely expensive, which are nowhere near as effective. And so this is the best in class, the best that anyone can do for you. And yeah, um, so that's.
I do have a lot of clear nail patients that actually, after they've had clear nail and they're happy with their feet, they stay with me
Mm,
and just come back for regular foot care.
mm,
And that says everything. The other ones are the patients that have got extremely thick toenails that are really badly infected, that had pain when anything touched it.
mm,
And once they've actually had the clear nail, now they say to me, you got rid of my pain. And that
mm,
can even be after one treatment
mm.
because you've thinned the nail and you've done your clear nail. And I've had people in within the first 8 weeks come back to me and say, I've got no pain now.
Mm.
That's it.
And I think you're, yeah. So, and this was an important thing, I think, for people who are providing a service, that you're providing a result for them,
Yes.
not sort of charging them by the hour as such. It may be how you charge, but essentially you're offering them a best in class service, which is going to get a result, because
Yes.
patients are so tired of this infection. Often they just want it better, want it gone, and
Yes.
you're able to say to them, well, we may not be able to get rid of it entirely, but we will give you the best in class. And in my experience, it can be extremely transformative. I've seen somebody with nails that are so I'll get permission to share that on the channel. I'll put it up, but they really are utterly distorted, thick, and they're not recognizable as toenails.
Yes.
And to be a bit crude, they were more like cornflakes than toenails, and
Yes.
they were transformed into something that's, becoming that. Well, it looks just like a nail. Whether it's entirely infection free in that case, I don't know. Time will tell. Well, but I've had them where they have gone infection free, but it's taken a couple of years to
Yeah.
get clear, normal growing nail again. And I always say, I can't guarantee that will happen. The
No.
damage is so sustained, but it is transformative if it's done well. And it's that's what I tried, but it's a balancing act, isn't it? You don't want people to you're what I thought was interesting. You're saying you're thinning the nails, so within 8 weeks, they're seeing particularly getting a mycological effect there. After 8 weeks, you're probably getting most of it dead. So they do change color, don't they? And
Oh, very
you've
much so. They
mm,
lighten in color. And I always say to people, with the Lamisil, you're going to get a white powdery look to the actual nail. Please don't worry about that, because that's the drug,
mhm,
terbinafine hydrochloride, that is actually working.
mhm,
So please don't worry about the whiteness, but they prefer the white to the yellow. So that's all right.
mhm. Yeah, yeah, and
Oh,
likewise.
yellow, green, brown, or black. Sorry.
Yeah, I always say that it goes to the autumnal color range. When it's effective, it goes from these sort of active orange, green, sometimes yellows to yeah, black. So it sort of goes to a like thorn colored brown colors,
Yeah.
and then you start seeing clear now come through. That sometimes that's all that can be achieved with a mycological kill, isn't it? That you will get,
Yes.
but you're also managing. I get the impression that you give excellent customer satisfaction because you're thinning the nails. You said you're very keen to get them pleased with it aesthetically. So they come in, and by the time they've gone out, they're already happy that they're under your care and they've got something is being done, and
Definitely.
you're giving them.
Definitely.
I think that's an important point, and thank you for explaining that.
And I really enjoy using the machine. I really enjoy it. I get pleasure out of using it, because I know that in 8 weeks' time they're going to come back to me. They're going to see something at the bottom of their nail that looks like a clear nail.
Mm,
And I love that when they come back and they can see it working. And they say to me, it's clearly working. Something's
mm,
happening. And I
uh,
say to them,
uh,
yes,
it's I've got to say it is hugely rewarding when you yeah, when something like a halux that's been really completely infected, and then you put holes into the germinal matrix, into the nail root, the drug's getting in there, and they've been painting stuff on it often for years, and all
yeah,
it's done is kind of make the top surface a bit of a hardened sheen almost. And you put the Lamisil sprays getting into the nail root, kills it in the nail root, and it erupts, doesn't it? It actually starts to grow at a different rate. Uh,
absolutely.
and starts to come through, as you say, often a bit milky. I find the nail is often opaque. It's not
Yes,
clear, it's actually opaque and milky when it first
yes,
starts to erupt, but it really genuinely erupts. And I think because you get a mycological cut, it starts to grow faster. Starts to
yes,
grow at the normal rate again. The rate was retarded by the infection. And when that's dead,
yes,
you start to see a clear line of growth. And that really is quite astonishing for people. Um, so it's a yeah, that's a deep sense of satisfaction clinically. Do you
yes.
have any sort of other sort of tips around using the device that you is there anything
Uh,
mentioned putting codes in? Do you think, like, by example, putting the code in before the patient um arrives,
no, no, no.
or
I do it all in front of them. I think it's really important to do it while they're sitting in the chair. Um, I've prepped that ready to do the clear nail, and then I'll set it up. I'll set the actual needle up. I'll put the cone over the top, and then I'll put the code in.
and patient position? Do you have a preferred position?
Probably, I would say leaning my elbow on my knee
Mhm.
to stabilize. That's a really important part, I think, of using Clear and Ale,
Mhm.
so that the probe, you're not up here. Oh, I don't know if you can see. Let me just,
Yeah.
you're not, it's not around.
You're not
So
sort of
it
unsupported.
would
Yeah.
be leaning, I would be leaning my elbow on my leg to
Mhm.
stabilize the actual probe.
Mhm.
Um, and their foot would be just right where you need it.
Mhm.
But I get them to be as relaxed as possible.
Mhm.
I think that's key, because if they're anxious, you need to be calm.
A
You need
long
to
time,
be,
isn't it, when they're anxious? Let's be honest.
yeah, they come in, they're worried. They think it's going to hurt. It
Mhm.
doesn't. They
Mhm.
do not feel a thing. And I did at the beginning have one guy that dropped off to sleep, and I said, well, all right then. um, but yeah, I just keep them as calm as possible and keep my arm, my elbow is my actual anchor.
Mhm. Yep.
I think
Yep. Yep.
I think that's a really good
Stability.
point.
Stability, I think it's very true. That's very important too. That's
Also,
where you get much better holes, actually. Yeah.
I think so. And once you've actually got their feet prepped, ready to do the clear and ale, change your gloves, get rid of all the fungus before you do the treatment. Any particles, spray their feet with Chlorhex. Make sure there's no dust whatsoever anywhere near where you're going to do your clear and nail treatment. And then I would change gloves, get rid of everything, new couch roll on the tray, because you're going to be tapping the actual probe now and again, to get rid of any of the nail dust that gets stuck in the cone, and make sure everything's clean before you do the treatment. It's key. I think that's one of the reasons most of the clients come back with a result. I really do.
Good. And any, if you got any other comments? Something I noticed with yourself. I think for a while you were domiciliary, and then you associate in a clinic. That's
Yes,
been a positive thing for you, isn't it? Or
absolutely. Um, because it's a medical treatment, it's using a needle. I think it's absolutely key for me to be in a really nice setting for them. It's much more clinical, it's much more hygienic, it's no wires that they can see around, because you've got the wire, the mains lead to the plug, just everything's set really nicely on the trolley. I just think it's a more professional treatment in that way.
and any tips on the COVID thing of late? Anything that you've changed as a result?
Um, to be honest with you, wearing a mask, I was sort of doing it beforehand anyway. I think it's really good for us because we're thinning the nails with drilling it. I think that's much better for our personal safety. Anything I've changed with COVID? I'm just trying to think. Not really. Not really. Just, I think keeping everything, we've got sanitizer everywhere, and we're doing that in between changing the gloves. We're doing that all the time because we're using screens and things, in the clinic. But I just think it's a much better environment for the person having the treatment.
It's worked really good for you. It's worked well, hasn't it? Okay, well, thank you so much for your time, Sarah. I think it's really insightful, and it's always a
You're
pleasure
very
to talk to you.
welcome.
You're always a very positive person, I would say. So, is there anything else?
Just to say thank you very much for inventing Clear and Ale. Um, it's boosted my business tremendously, and I've always been because I had a fungal nail myself, did you get that? I don't have a fungal nail anymore, I'm pleased to say.
Oh,
I know
thank you. Yeah.
it's nearly 6 years on, but it's phenomenal, a phenomenal machine. I love using it. I'm really motivated, and people say to me, you get really excited about toenails, but we've got to remember there wasn't anything that worked before this. So people would go out and spend lots and lots of money on topical treatments that didn't reach the nail bed. And truly and honestly, there's lots and lots of them, but they don't work. Clear Nail does. And I'm so happy about the future of my business, because it's rocketed since I've had Clear Nail, really. It's been great. Absolutely
Do you
great.
want to just give any details about if people want to find you, contact details, to how to get?
Basically, you can go to the Dunstable Foot Clinic. You can basically put fungal nails in Google, but the Dunstable Foot Clinic, I'm always there on Tuesdays and Wednesdays. They're the 2 days that I do. And I do evenings as well. Those 2 days I will stay as long as I need to do as many clear nails as possible, and to make sure that the patients come back afterwards. And it's a whole process. It takes time. So I will always be there for the client to get the result that the client wants as much as we can. Thank you very much, Rolf.
And I think that's why you're so successful. Thank you, Sarah. Okay, we'll let me see if I can do my major IT bit now and stop the. So
Thank you.